My name is Austin. I'm going to be your student nurse today. I'm going to be doing a head-to-toe assessment on you, which is just a general overall assessment of your body. We're going to, first off, you want to identify your patient by their name and date of birth. So you check their armband, check their orientation to person, place, and time. And then you also, whenever you come into the room, you want to check their vital signs. So check the temp, respiratory rate, heart rate, blood pressure, and O2 sat. So now I can begin my assessment. So first off, check their eyes. Shine a bright light in your eye. Just follow my pen light. You really want to check to make sure that their pupils are equal and round, react to light with accommodation. You also want to check the oral mucosa and make sure it's pink and moist. So you can just let down your mask. And then now I'm going to listen to your lung sounds. So we'll start on the posterior side. And you really want to use a side-by-side comparison. Kind of start above the clavicle on the posterior side like you would do on the anterior side as well, and just work your way down. And when you're doing your auscultation of the lung sounds, you're looking for bronchovesicular and vesicular breath sounds. Note any wheezing, rhonchi, or rales, which are adventitious breath sounds that are abnormal. Fine crackles or coarse crackles. And on the anterior side, start above the clavicle again, using a side-by-side comparison. Working your way down. Also in the trachea region, you're also listening for bronchial sounds as well. So now I'm going to listen to your heart sounds. So you can go ahead and lean back. And listening at the aortic valve, which is the right second interspace. Then you have the pulmonic valve, which is the second right interspace. You have Erb's point, which is the left third interspace. You have the tricuspid, which is the fifth interspace to the left. You have the mitral valve, that's left to the midclavicular line. Then you have the epigastric region as well. Now I'm going to listen with the bell of my stethoscope and a backwards motion. That can really help you hear heart murmurs, things like that that are really hard to hear. Then you're going to listen to the GI system. This is a good opportunity to ask about when the patient had their last bowel movement, and also their urinary system, if they're voiding normally for what they normally do, if their urine is clear, yellow, if there's any abnormal changes in it, if it's dark or bloody or has any sediment. And also you want to check if they have a Foley catheter, what's in the bag, and make sure you measure intake and output appropriately per shift. You want to auscultate the GI system in all four quadrants. You want to auscultate before you palpate. If you palpate, you can kind of stir up the bowel sounds. want to palpate it from each quadrant. You're really looking for any tenderness, distension, protuberance. I really want the abdomen to be soft and non-tender and non-distended. So now we can check skin turgor, which you check above the clavicle. And if it's instant, that shows that they're well hydrated. And also checking capillary refill, which is less than 3 seconds. And then while you're doing that, you can check their radial pulse, make sure they're equal bilaterally. And then going into the lower extremities, you want to check their pedal pulses, make sure they're also equal bilaterally. Usually a normal reading is +2. And you also want to check their musculoskeletal system. Alright, if you can press up against my hands and lift up. You also want to check sensation as well. You can do that and ask them to state where you're touching them at to make sure that their sensation is intact. You also want to make sure their skin is clean, dry, and intact with no lesions, open wounds. If they have a surgical site, check it to make sure it is intact. If there's any drainage, any redness, or signs of infection. You also want to check their upper extremity strength. So squeeze my hands, okay, pull me, and push against me. And that completes your head to toe.